Okay. It's all yours. All right, so did everybody do their quiz? Everybody get their quiz? Someone was excluded from the emails, which I thought was kind of rude, but yep. So you can take it. It's a take-home quiz, so you can use your video from last time, and you can cheat on it because there's going to be some great prizes. All right, so whoever gets the best grade on the quiz is going to get a really cool shameless plug for us, Robin's Rehab hoodie.
Oh.
Exciting. Second place will get Robin's Rehab wine, or if you win first place and you want the wine instead of the sweatshirt, you can do that. So,
I know where Sue's going.
so take.
Can we drink it now?
So take the quiz. We'll take a look over it. Yep.
No problem.
All right. So you got off your handout here, right? So we're gonna okay, good. All right, so we could have written a ton of stuff on here, but we didn't want to overwhelm you. So this is just to kind of keep us on track. If you guys, again, if you have questions as we're going along, make sure you ask them. The more you understand this stuff, the better. Guess what? Evaluating the spine, I like to say, if you follow me around for a week, I could tell you how to do my job. It's not that complicated. We try to make everything as simple as possible. Evaluating the spine is a little different if you don't know all of the anatomy that's going on there. But after tonight, we're going to go over some basic anatomy type stuff. We're not looking for you guys to like tell someone, yeah, man, you got an L4, L5 disc injury there. You better get that cleaned up. It's just like, let's try to find out. I can ask you a couple questions, have some basic knowledge of what's going on. We're not asking you to diagnose anybody that comes in here, just kind of how to direct traffic when someone has back pain, especially when they're running. And we're going to give you some basic principles about why people have back pain when they run. Anybody know why people have back pain when they run? Because their back hurts? Good.
Tight hamstrings.
Okay, tight hamstrings, posture, compression. What's that?
Weak abdominals.
Weak abdominals. Okay. So
Leg discrepancy.
what's that?
Leg
Leg length discrepancy. Whoa, who's this? Okay, good. Medical practitioner. There we go. All right, good. Leg length discrepancy associated with an SI joint problem, which we're going to go over. So yeah, all those things are really common. So we talked about this last time. If you run, fairly consistently for 365 days, what are your chances of getting an injury? What percentage of people?
100.
It's pretty close to that, unfortunately. It's 90, right? So, yeah, you're close to it. Yep. So it's just a matter of when they're going to have breakdown. We're not talking like catastrophic injuries, but things that bother them when they run that might, cut down on their training, have them not get ready for races, miss races, pay all that money to do those races and can't do it. So it's part of your guys' job to make sure that you're helping them out. Find these problems like when they're at the beginning, because the sooner we get our hands on things, the easier it is to fix. So spine evaluation, tissue impairment. So again, I'm not asking you guys to try to find out what's causing this problem, but I want you to understand the tissue in the spine. So most people know what a disc is, right? Do you guys know what a disc is? All right, what's a disc? Now be careful nodding in my class, okay? What is a disc? Don't overthink it. We're trying to get some.
Disc.
Yeah, so like a little the spacer in between the vertebrae, right? So you've got, yep, spongy, cushiony, right? So it's the yeah, you've got a lot of them. So they're in between every segment of your spine, cervical spine all the way down to your lumbar spine. What is the job of the disc?
Impact.
Okay, so impact, so like cushioning, right? That's what you're kind of saying, right? So shock absorber, right? Okay, it is intimately involved in mobility, which we're going to talk about in a second. So, and most people think it is kind of like a shock absorber, which it is, but its most important job is that it's a ligament. Anybody know what a ligament does?
Bone to bone.
Okay, but it attaches bone to bone, it stabilizes bone, right? So a muscle is attached to bone by what? Anybody know? Bone is, there you go, nice, okay. So this is a ligament. Anybody ever sprain their ankle? You know how to, like, what happens when you sprain your ankle? Like, I think we talked about this last time, where you sprain it, kind of stretches things out, and then it's kind of wobbly, right? And that's the most important thing that a disc does. Once you have a disc problem or a disc defect, then you lose the structural integrity there. So if there's two segments that sit on top of one another, think of the spine as just a bunch of blocks that sit on top of one another. In between them is a disc, which separates them, yes, for cushioning, but it holds them together. So you want some motion in that disc, right? Or so some motion between the two segments. If it's too much motion, excessive motion, that's not good. If it's too little, that's not good either. So once you have some kind of disc injury, can anybody name any disc injuries? Like what happens to a disc? Herniations, right? Ruptures, yeah.
Degenerative.
Yeah, well, slipped is kind of a weird term. That's like, it makes it sound like the spine is Jenga. So it's not really, but it is a term that's used for like some kind of disc defect, right? Bulging, like degeneration, all of that stuff. It just means the disc isn't in its original condition, right? Guess what? I see all of you here. If we take an MRI on all of you, you're gonna have disc findings. Dakota and I've never gotten an MRI back that says, "Psh, looks good." Like, this doesn't happen, right? So you're gonna have some kind of disc findings. Are those disc findings relevant or not? That's what's important. And not all disc injuries require surgery. Like a lot of people, for whatever reason, they hear disc problem and they think, oh, the only thing that's gonna fix this is surgery. Really what's happening is you've lost the segmental stability there and it moves too much. So if you can stabilize it, then you're gonna have success with getting rid of pain. And there's plenty of people, you included, that if we went and did an MRI on you, would have some nasty findings and have no back pain, right? So that doesn't, it's not a death sentence, is what we're trying to get through there. So Dakota, talk about vertebrae and nerves. What are those things?
All right, so Travis already mentioned that the disc is what sits between the vertebrae. So the vertebrae is just where you're gonna get all your movement, okay? So we have a bunch throughout our entire spine. We have 7 in the cervical spine or in the neck, 12 in our thoracic spine, and then we have 5 in our lumbar spine. So there's a total of, does anybody do the quick math there? So I said 7,
So
5, 12.
Which one you guys went to happy hour before this?
great at math. Great
All
at
right.
math.
So doesn't matter if you know how many there are. Okay, I mean we are talking about low back pain. Okay, so but the whole idea is that there's a lot. Okay, and when Travis and I see patients that come in with low back pain, typically we see people with pain that's going to be very, very in the low part of the back. So I said before that there's 5 vertebrae in the lumbar spine. Rarely ever, unless we have like a really, really old lady that unfortunately would like fall, or an old man that would fall. Rarely do I ever see pain that's going to be in the upper lumbar spine. So more in this area. Okay. Most injuries that we're going to see are going to be like L4, L5, or L5S1. If you hear a lot of people that say, "Oh, I've had a back surgery," most of the time they're going to have surgery in the lower lumbar spine. So the purpose of the vertebrae is just where you're going to get that movement from. So there's movement or excessive movement there. You could be putting degenerative changes onto the disc that sits between the vertebrae. Okay. You can also be leading to kind of pinches off to the side, what are called the facet joints. So those are just where all the movement comes from in the spine. And that can be like if someone says, "Oh, I feel like I need to crack my back," or they feel a pinching, especially at one local spot. So if someone says, "Yeah, I have like this pinch at one spot, I just can't get rid of it," typically that's going to be something, a facet joint caused by the vertebrae. The next part is the nerves. So I think we did talk a little bit about nerves last time, if I'm correct.
Yeah,
more like in the tarsal tunnel with the foot, right? Well, someone can have foot pain, but it really can be coming from the back. And again, like Travis said, you guys aren't the ones that should be like, don't have the experience obviously to evaluate this. Like you're just trying to do things to try to help these people and do a quick fix that most of the time can help. However, with the nerve, we have all those nerves that come out of the lumbar spine, and some of them come out through the sacrum as well, and they go down the leg and then all the way down to the foot. So if you have someone that's complaining about like burning pain, they think, "Oh, I'm like pulling my hamstring." Sometimes what can be a hamstring pull really is actually nerve irritation. Some people just might not know the difference, and which isn't uncommon to what we see. So if there is an irritation, or if the lumbar spine is moving excessively, you can have something like Travis was mentioning earlier, that disc is getting irritated, or even excessive movement or not enough movement can be putting pressure on the nerve and then giving pain more down the leg. So if someone says, "Yeah, I have pain, but then partway through my run, I'm starting to get a lot of pain down my leg, down the back of my leg specifically." So has anybody heard of sciatica? That's so when Travis is saying about disc, a lot of people know what that is, right? The most common thing I think we hear is like, "Oh, I think I have sciatica," or like rotator, if we talk about shoulder now, but rotator cuff, that's like the 2 things I think people know most about when we're talking about injuries in the body. So those are going to be those specific movements. So I mentioned the sacrum, and I'll turn it over to Travis here for the next one. So the sacrum is part of what's called our SI joint. Travis is going to talk a little bit about that next.
So anybody ever heard of an SI joint problem? Or we've already heard leg length discrepancy. That's really high level. Leg length discrepancy, all it means is if I laid you down on a table, one leg would be longer than the other. Has anybody ever been told that by like a physical therapist, chiropractor? If we took you guys right now and we did it really quick, put you on a table, probably half of you would have a leg length discrepancy. Does anybody think that one leg's longer than the other right now? Yeah. Usually not noticeable. Very rare does we have like a huge leg length discrepancy. But what happens is when there's an imbalance there, it kind of throws everything off. I don't know a lot about cars, but when your car's out of alignment, then what happens to the tires? Anybody know?
They wear funny.
Yeah, they'll wear funny, right? So one will wear out faster than the other because the car's not in good alignment, because when it drives, it kind of pulls one way or the other and you end up wearing something out. It's a really common analogy that we use in physical therapy. If your SI joint is not in the right position, then you can walk around with that. You can run with that. Lots of runners have it because when you're running, you're putting all your weight down on one side, and then you're transitioning, putting all your weight down on the other side. Even when you're walking, you're doing that. So if you're having an SI joint problem and something's out of alignment, that can cause a lot of different symptoms, because now all of the muscles that are attached to my pelvis, which there's a ton, are kind of in weird positions. All of the nerves that go down the back of my leg will also be put in different positions. So we had a kid this summer. He plays for the Jets. He went to Division I school, really good SEC school, and he ends up in our office for some weird reason that takes too long for me to explain. But he was told he has a hamstring strain. This kid's getting ready for the draft. And he didn't have a hamstring strain. He had an SI joint problem that was causing a nerve irritation that seemed a lot like a hamstring strain. And to me, this still always blows my mind when we see high-level athletes, like, how does this crap get missed? But for him, we cleaned him up, treated him like 2 or 3 times, fixed his SI joint problem. He went off with the Jets, talked to the trainers there, and just kind of cleaned up. Those guys saw it, but for whatever reason, the trainers that worked with him at his school didn't see it. But they're really simple, easy fixes type stuff that if you have someone, for your guys' purposes, I've had this hamstring problem for years. I did physical therapy. I do like soft tissue rolls. I do like stretches and stuff. Nothing gets it better. And it's probably because there's some kind of joint position that's causing that. You cannot outstretch and now like soft tissue mobilize a joint dysfunction. You can't do it. It has to be corrected. So for you guys, your SI joint problems, there's going to be lots of combinations of symptoms. But the one thing that someone's going to come in and say is, man, I get pain right here. And they'll point right to their SI joint. So it's kind of the middle of your spine and then off to the right and off to the left. So you got 2 of them. Right? Someone comes in and says, man, I got pain right here. They've got an SI joint problem. You guys can diagnose that. Okay? Other stuff, like what's resulting from the SI joint problem, like the nerve pain, hamstring issues, shortness of the quads, depending on what position the SI joint is in. So your ilium can be rotated forward, it can be rotated back. That stuff we kind of clean up on exam once you come into physical therapy, but there's lots of different things that have to be kind of looked at, especially with runners, just because they're not going to stop running, right? So we've got to kind of get them in and clean that up. But those are kind of the different tissues that are involved with that. Again, we don't expect you guys to remember all that stuff, although we'll be on the quiz if you want to win the wine. But we'll kind of help you out with that once they come into our clinic. Let's talk more about, people will tell you a story of what happened with their injury, right? They come in, maybe they're having some kind of injury. I think maybe it's my shoes. Let's change some shoes and see if that happens. A lot of times that does happen, like that helps them out. But for the most part, very rarely does a runner come in and say, yeah, I stepped in a pothole, or yeah, I fell off the trail and something happened. Super rare. And in almost everything we see, very rare do we see traumatic stuff. What is the most common? Someone comes in, patient says what?
They're like, oh, I was just doing something that I normally do over the weekend, and then suddenly I started having pain. It wasn't anything that was out of the ordinary. Like, I was the person that said they threw out their back when they threw the pillow on the bed. So then I had to back up and say, well, what were you doing before that? And they're like, oh, I'm just doing my daily stuff. But it's, again, repetitive movement. Travis alluded to earlier, what's running? A repetitive motion. So they're basically kind of keep building up, and then eventually they do accumulate so many reps of either they're back in a poor posture, or we talked about the leg length, or tight hamstrings, or something that's leading to the dysfunction, weak abdominals, and then just kind of blows out. Okay, not to be blowing out in the way that's like there's a traumatic injury now, but now the body's basically said enough's enough, and now you're going to have pain and resulting in inflammation. So,
yeah, so any kind of injury, but especially running, it's sustained poor posture and repeated microtrauma. So it's just the same stuff over and over again. A lot of times you will see, though, if you ask the person that comes in, around the time you started to have this problem, did you like increase your volume at all? So they'll be okay at a certain volume, and then all of a sudden, yeah, I kind of jumped up. I was set on like 7 and 8, and then I did a 12 over the weekend, and that, yeah, after that, that's what really happened. Right? I didn't even put that together because I was just like running, like, wow, I've been running for 5 years, and now I have pain. This doesn't make any sense. So when it looks like it says insidious onset, it means they really can't relate it to anything unless you kind of pull a little information out of them. All right, so this thing, now you guys are going to start watching this. So physical therapists, we're dorks, right? So you know what our favorite thing to do is sit in an airport and watch people walk. It's like, oh yeah, that guy had a knee replacement like 6 years ago. Like, oh yeah, that guy's got a right SI joint. No way. And then we're like, me and Dakota are in the airport, like, we need to go talk to that guy because he thinks it's one thing, I think it's the other. So I'm going to tell you guys how to watch people walk, and there's a ton of stuff that goes on with gait analysis, but for you guys, what you're going to see is, have you ever watched somebody walk and their hips move a lot? You ever seen that? Okay, so start watching people run or walk. And some people will, we call them like their tail is wagging, right? So if their tail is wagging, what's happening is they're getting excessive motion in their lower lumbar spine. That's happening because their hips are tight, or the thoracic spine is tight, or both. So what we have to understand is when you guys are watching the analysis, and as you watch this, you'll pick it up in like a day. Like if you watch 10 people walk in a day, you'll say, oh yeah, that's what that guy was talking about. You'll see some people that when they walk or run, they stay pretty stable. Their hips are not moving. What do you think that tells you? If they're not wagging a lot.
All's good.
Well, pretty close. Yeah, so they're doing a good job of stabilization here. If their tail is wagging a lot, they're not doing a good job of stabilization here. Now, we don't expect you guys to get down on the floor and like show them how to do stabilization exercises. We want to do that. That's great. I know you guys have some training on it, but you guys are typically pretty busy on time to do that. But that's kind of what's going on. So if someone comes in and says, yeah, I just like ache in my low back. It bothers me when my miles get up. And yeah, as long as I kind of cut down on my volume, I'm fine. That's kind of like an accident waiting to happen, because they're like have a lot of excessive motion in their lumbar spine because they're not stabilizing well, and they probably have really tight hips, or they might have a tight thoracic spine. So anywhere in the body, but especially in the spine, where something's not moving, and something below that and above that has to move excessively to make up for that. So Dakota talked about all the segments of the spine, right? So you got a bunch of blocks that are sitting on top of one another. If we went through and evaluated your spine, we would say push at places like, yep, this one's not moving. And because that one is not moving, this one and this one has to move excessively to make up for that lack of motion. That happens globally too. So if the thoracic spine doesn't move, so your mid-back, which nobody's thoracic spine moves really well, because I don't know about you guys, I don't even work on my thoracic spine as much as I should. I'm sure you guys don't. It's not something you like go home and do. It's like, oh yeah, I gotta work on my thoracic spine today. That doesn't move. And typically with runners too, their hips will be tight. Right? Some stretch the crap out of them, and they're too mobile, and that becomes another problem that we won't talk about. But for the most part, if your lower lumbar spine moves too much, it's because your upper lumbar spine and your thoracic spine is not moving enough. That's stiff, and your hips are stiff, and then that's where the motion has to come from. And that's why 95% of disc injuries in the lumbar spine happen at L405, L5S1, because of the mechanics of how humans move around. No matter what job you do, you're gonna have excessive motion there. So you guys can take a look at that. I'm telling you, watch it, like when you're walking down the street, like some people's hips move a ton, and some people's don't move at all. And then you can walk up to the ones that don't move at all, and you say, man, you got some really nice abs. Any questions about that? All right, so let's go through some basic evaluations. So you guys are just kind of using your visual system to kind of look at stuff and see if you can pick up on stuff. We talked about that last time, right? So we had you, and anybody do the single limb squat with some people that came in? I know you guys haven't had as much traffic in here, but trying to take a look at that, right? Just look at that quickly. Have you not done that? Have you done?
No, I've done it. Okay,
but you looked at people doing it? All right, I thought you were shaking your head. Good. All right, so it's the same thing. As soon as you see it like 10 or 12 or 15 times, like, oh yeah, I can kind of see what's going on there. Same thing with this stuff. You're looking at that lumbar spine to see if your tail's wagging, you'll be able to pick up on that. But we'll give you a couple other tools here. If someone's coming in and has back pain with running, well, first you guys tell me, what if somebody came in and said, yeah, every time I run, I have back pain, but it doesn't stop me. It's kind of annoying, but I just keep going. Where are the shoes? Like, what do you guys do?
Put them in a low heel shoe,
Okay, why do you do that?
so it cuts it down and they can decompress the spine, stand up a little straighter.
Okay.
Rather than wearing a high heel.
Okay, so it changes the mechanics of the spine for sure, so they can try that out. So if they did that and the pain didn't get any better, what would be the next move? You guys, it's not like you're following up with these people typically. They're buying their shoes and taking off. But so that's one thing that you can try that is in your guys' toolbox, right? You guys are the shoe guys, so that's in your toolbox. You're not going to get somebody on the ground and manipulate their lumbar spine. It's not in your toolbox. So that's one way to do it. For what we want to do and to kind of teach you guys how to do is just kind of look at where the pain is, what kind of pain they're having, and you can do a really quick flexion extension test. So if you guys don't feel comfortable doing this with people, that's fine. Go do it with like your friends and family at home just to kind of check it out. But when someone has back pain, the amount of flexion and what they feel like when they flex forward and extend back will give you a lot of information. So Dakota, talk about that. Like if these guys sometimes they had back pain and came in with shoes, then we kind of look at their flexion extension. How can they use that information?
All right, so we'll kind of talk about the flexion extension if you think about things we talked about above with the tissue impairment. So if someone bends down, you said, okay, I want you to go down as far as you can and touch your toes. A lot of times that disc, like Travis said, is trying to resist that motion, right? We talked about how it's a ligament. So if you're going down really, really far, typically what we find is that a lot of people, that disc is going to be really irritated right in the center of their back. Okay, so Travis talked about where's the pain. Center of the back, It's not going to feel a lot better with bending down because basically you're tugging on it more and trying to make it looser, okay? But then a lot of people, what we'll see is when they bend backwards, they're like, oh, that feels better, okay? So again, center pain, that's going to be the disc. Bending forward, it's usually going to feel generally a little bit worse. Bending backwards, generally is going to feel a little bit better. So now, the next one down, the vertebra. So I liked what Andy was saying about how if you put someone in like a lower shoe, it's going to decompress the spine, talking about that. So really what you want to think about is if someone runs like this, they're arching their back a lot. So when someone's doing that, let me ask this. Why do you think someone does that? Why would someone really arch their back backwards when they go to run? What do you think is causing that? What do they compensate? Okay, posture. So it's so that's going to be their running posture that they're going to have, right? It might even be their walking or just general standing posture. But what do you think they're compensating for? This is something that someone mentioned earlier. Could be weak core. Yeah, more the weak core. We typically see someone's going to stand like this because what they're doing is they don't have the control. So basically, when you extend your back, you're basically making it more stable. Okay, it's really hard to make someone's back move more when they're bending back versus when you bend forward, you can really twist and bend your spine a lot more. It's a lot harder, it's a lot more uncomfortable when you're bending backwards, okay? So something like that, if someone feels a lot better with flexion, then what you're doing is they're basically decompressing their spine, okay? Just like you said, you're gonna lower their heel, it's gonna get them out of this extended posture, it's gonna feel a little bit better. Versus when they extend, like, oh yeah, it actually feels worse. It's because their back's naturally already gonna be set in a little bit of extension, okay? So if someone extends back, and it's caused by the vertebrae compression through what's called the facet joints that I mentioned earlier, then that's going to feel worse. They bend forward, it's going to feel a little bit better. The next one's going to be nerve. If you bend down, touch your toes, but you feel like your hamstring's tight, which we said earlier could really be mistaken for a nerve irritation, you go down, someone's going to say, you know what, my back actually doesn't feel too bad. I feel maybe a little bit in my back, but I feel it all down the right leg a lot more. Okay, that's what you're going to be looking for. So they're going to be limited there. And then there's not going to be much limitation usually with a backward bending type position. Okay, they might still have some general discomfort in their low back, but typically you'll see them say, yeah, I'm bending down and I feel this like immense stretch in one side. Okay, if Travis and I see someone come in and like it's very rare to have someone with sciatic issues or nerve issues down both legs. It can happen. Okay, it's not completely uncommon, but it's not the most common thing we see. Typically you'll see one side worse than the other, okay? If someone's bending down and their range of motion is limited and they feel it in both legs, I would bet more on that actual hamstring tightness, less of nerve irritation, which can, again, be affecting the way that their back's moving. Like Travis said earlier, if our spine is moving a lot more because our hamstrings and our hip flexors and quads are tight, then that's what you're going to be seeing and say, hey, maybe you want to stretch out your hamstrings a little bit, take care of your back, along with maybe some shoe modifications, okay? And then with the SI joint, that one is definitely going to vary. That one you're going to be wanting to think about what Travis said. Where's the pain? If someone doesn't point right in the middle of their back and then they point right to here on either the right and left side, that's what you're going to see because that person can have pain or discomfort with either flexion or extension. So that one's more about where's the pain, less of how is it going to respond to the bending.
All right, so quick fixes for this kind of stuff. Someone comes in and you can change the support by kind of posting the arch. We taught you guys, and you guys know better than we do about what the foot looks like. If you see someone come in and they've got, I saw the worst flat foot this week I've ever seen in my life. I've been doing this for 20 years. This is I wanted to take a picture of it. So we call them Mississippi mudsuckers. So they're like flat down on the ground. Okay, so they're gonna have all kinds of problems. You start to post their arch, and you'll probably clean up a lot of stuff that they've been having problems with. It's rare you see someone with a super flat arch that doesn't have something going on, but they just love running so much that they want to keep doing it, which is awesome. So you guys can help them out in that way. And some of this back pain stuff, if you catch it quickly, if someone comes and says, yeah, I've been starting to have back pain like the last week or so, same thing for us as it is for you guys. If you can get them in a shoe that's more amicable to their body and you kind of find out what's going on with their feet, because really the foot is the most important thing. When the foot hits the ground, like that affects everything else that goes up the chain. So if you can get them quick, then usually a shoe change or some kind of arch support can help out with that. If they say they've had this problem for like a year, it's probably rare that you're going to get them in a shoe that's going to fix all their problems. It might happen. I hope that does. But for the most part, the length of time they have in between that when that pain started and when you get to the intervention, whatever that is, if that's shoe change or if that's coming into physical therapy, it's going to be easier to fix. So you guys can obviously do all the stuff you normally do and see if a change in footwear or change in arch supports can help them out. And then moving the thoracic spine. So again, we're gonna give you guys some tools for this. So I owe you guys some rack cards in terms of things that you can hand out. So if you identify this stuff, it's like, oh yeah, I should give you this. This is what that guy talked about. One, you should look through them, because if you guys are having some of these problems, it can be quick fixes that you guys can do. But also you can kind of help direct people. So in general, if you're seeing that big wag there, if you mobilize their hips and mobilize their thoracic spine, then you're going to help them out. It should at least take some pressure off that, unless there's some kind of significant structural issue that's going on that needs to be corrected with, physical therapy or something else. So those are some easier things. Again, for you guys to know how to, do these 3 exercises, that's a lot. So we'll give you guys all tools to help out with that. But just understanding the concept of, if they're having back pain, their tail's wagging a lot, if we get the thoracic spine to move and the hips to move, that's going to help out. Even if you just told them that, they would probably trip over some decent stuff on the internet, although it depends on what you find. But we're going to give you some tools to kind of help you out with that. All right, and so we went over this. This was on the quiz as well. So it's time to get some help when they've had the problem for more than 30 days. So again, like we talked about, if they've had the problem for a couple weeks to 30 days, you're like, let's try a pair of shoes. If this doesn't work out, then you probably want to take this a little bit more seriously and get this fixed before it becomes a huge problem. So we talked about that before. Change in footwear does not improve their symptoms. So you guys use the tools that you have. This happens to me too. We don't fix everything. I like to say we fix a majority of stuff, but sometimes it just kind of gets above us. We're like, I gotta have somebody else take a look at this. So when you change their shoes and they come back it didn't help out. What is the next pair of shoes you got? It's like, well, maybe we need something a little bit stronger to kind of help figure this stuff out. And then if the pain doesn't go away with complete cessation, stopping the activity, if they stop running, shut it down for 2 weeks, which is really hard to get a runner to do. But let's say you did that. You said, hey man, if you stop running, the pain goes away, then maybe the tissue just needed some time to recover. Most of your runners are not taking a lot of days off, right? Some of them are running almost every day. So if you completely shut everything down and the pain went away, maybe the tissue was just inflamed and it just needed a little bit of rest, and then it can kind of slowly go back to that. If that's not the case, if they shut everything down and the pain doesn't get any better, then there's probably something else going on there that we have to fix that they can't overcome, like an SI joint problem, like a facet joint problem that's stuck and they're just not going to unstick it no matter how much they stretch or soft tissue roll or anything like that. All right. Any questions about anything? No questions? You guys know how to evaluate spines now? That's awesome.
No problem.
Yeah.
So, can you speak to anything of one hip being forward than the other,
Yeah, so you have 2 iliums. So everybody can put their hands on their pelvis, and you feel these big pelvic bones. Your pelvis is kind of like a bowl that holds all your internal organs. Right? So when we talk about a leg length discrepancy, we're talking about one of these iliums. So you've got 2 big iliums, they come together, and there's a wedge that goes in between them, and that is your sacrum. Okay? And that is what holds your pelvis together. So if I have my right leg is longer than my left, I lay it on the table, my right leg is longer than my left. There's 2 things that can be going on. Dakota, what are the 2 things that are possibly going on if my right leg is longer than my left?
So it's either going to be that your right leg looks longer because your right ilium is forward, or it could really look like your left leg is shorter, and in that case, your left ilium will be rotated backwards.
Yeah. So that's 99% of the time, that's what's going on. There are true leg length discrepancies. You got to get an x-ray. They got to measure it on x-ray. Man, I haven't seen one of those in a long time. If you had a fracture when you were a kid, under the age of 18, or you had a knee replacement or a hip replacement from a long time ago, there might be a true leg length discrepancy there. But for the most part, it's an SI joint problem. So if I had one leg that's longer than the other, what are some common fixes for that? You're at home, you guys are biomechanics. What would you do to fix that problem? Don't overthink it.
Somebody pull up.
So that's actually how you fix it. Okay. Yeah. But have you ever had somebody come in with their shoes and they have a wedge on one side?
Yeah, left.
Right. Okay. You seen that? Okay. I would say 9 times out of 10, that's not the right way to go, because more than 9 times out of 10, they don't have a true leg length discrepancy. Now, if they come and say, oh yeah, I had a fracture when I was a kid and my one leg is actually longer than the other, that's the only time you should see that wedge. But sometimes you'll see people that will just kind of put that wedge in, and it's helpful, right? It's kind of it's one version of a fix, similar to how a back brace works. So have you guys ever seen going to Home Depot or Lowe's, you see the guys with the back braces? They hand those to you when you get your working papers. I don't. Some physical therapists or chiropractor started that because we get a ton of business from that. Because what happens is it's a really effective tool in getting rid of acute low back pain, or even sometimes kind of prevention of low back pain. But the problem is those guys wear those all day long. And so what do you guys think? If I did all the work that the muscles are supposed to do in the spine, what do you think would happen if I take that brace off?
The muscles are
Bad
working.
things. Yeah. right? So your body is an efficiency machine. If you do something for your body's like, great, I don't gotta do that anymore, right? So we don't see those, we see people from Home Depot and Lowe's. It's not because, I've never heard someone come in and say, yeah, I was picking up this huge pallet and I hurt my back. Never happened. You know when we see those guys? I took my brace out, I went to go and untie my boot at the end of the day because they went, bend down, the muscles are like, whoa, you've been telling me all day I don't have to do anything, now you ask me to do something, boom, they have a disc problem. Right? So a lift, back to my long story, a lift will kind of do that. So it'll fix the problem, right? But there's other mechanical issues that are going on that are going to continue to cause that problem. And we even get, I love chiropractors, good ones. I go to a chiropractor. This isn't like chiropractor versus physical therapy. For whatever reason, like chiropractors are supposed to be the best at like mobilization and alignment, right? And I see a ton of lifts given out by chiropractors. Like, man, you got to do your job. Like, what is going on here? Like, you need to fix that leg length discrepancy because it's super simple to fix. Again, if you guys followed us around for a week, you could fix leg length discrepancies. It's not that hard. So it's just kind of correcting for that. So when you correct it, like 99 out of 100 times, when we do a mobilization to correct that, it fixes. Sometimes it takes 2 or 3 times. For the most part, that first day, boom, we got level legs. The problem is, if you walk to your car and come back, it's probably going to fall back out because your body's been used to this. We put it here. Well, we've got to train those muscles to maintain it, and it takes a little bit of time. It's worth the effort, but it does take a little bit of time. Did that answer your question? Okay, good.
Psoas
Where's the psoas? Anybody know?
connects the upper to the lower hemisphere up here and then comes to the front.
So it's front of your hips, yep, it's a hip flexor, right? So it's a really cool muscle. Why? Because it attaches right here in front of your femur, and it goes all the way back through your pelvic floor, and it attaches to the front side of all 5 of your lumbar vertebrae. Okay? So that muscle is a hip flexor. And in bad situations, it actually, some people will use it to stabilize their spine, which you don't want. Okay? But some people, if their muscles are not strong here, they turn their hip flexor on. This is the person that comes in that will run kind of forward because they're using their psoas to kind of stabilize their spine, or they'll just kind of walk in a forward position. So that muscle typically is short. If we were to measure it on people, it's going to be short. Why is that? Because most people spend a lot of their time doing what you guys are doing right now, right? So what happens when we sit? I bring the 2 attachment points of the muscle closer together, and then I stay here for a long period of time, and the muscle's like this. And then when I go to ask it to stretch out, right, when I put it off like that, then you'll see what Dakota was talking about, where you'll get a lot of extension in the spine. One, because they just can't stabilize. They get into extension, the facet joints all sit down, and that's a real stable position for somebody. Problem is, if you do that long enough, then you're going to have problems with degeneration, like you're going to wear those joints down, and as you get older, then you'll start to have fractures. So people that, any of your runners that are over the age of 65, and I don't know exactly what your demographics are, but what do you think percentage of people that come in here that want running shoes that are over 65? Is it like 3%? Is it like 30%?
I'd say 10 to 20.
10 to 20%, that's kind of what I would guess, right? So those people you've got to kind of worry about, especially if they're in a lot of extension, if they have these little hairline fractures. And for those, if someone comes in that's typically older, again, this can happen in a younger population, it's not guaranteed to happen in an older population, they're just more susceptible to it, is they'll come in and they'll point to their spine, not kind of below their spine at their SI joint, but they'll point up here and they'll say, yeah, I got this like one spot right here. That can be a couple things. It can be a facet joint issue, or it can be just a small fracture. And they'll say like, yeah, it's just kind of like a dull ache. I'm okay if I stay under 5 miles, and then once I get up a little bit higher, then that really starts to bother me. But when I stop doing it, then it feels fine. You know, a lot of people think of like a spinal fracture as like a disastrous thing. There's lots of people walking around with like small hairline spinal fractures, but they'll say like, I got this like one spot right here, and that bothers me. And then as I increase my volume, then that kind of, it makes it worse. All right, so that muscle, again, there's a specific test. Like you can't say something, yeah, it feels really tight here. And when I get into a position here, that feels like even tighter. That's not a length test for the psoas. That's, you got to get them on the table, you got to compare it side to side and find out if that's a real problem. That could be a length issue and it's tight, or it could be that it's just really irritated because it's overactive because it's doing too much work that's stabilizing here. That could be a long psoas. Like it might be too long for that issue, to have problems with it. It doesn't necessarily mean that it's short. I will tell you, in the majority of times, for the most part, it is short because we're sitting a lot. Good question. Anything else?
Okay, probably the last question. But like the kidney bean runners, so we talked about like overextension, the anterior tilt. What about like you see people that look like little kidney beans?
So like
Trail runners.
it's coming like this. Alright, so this is
It's like this, like
Slouched forward.
this forward head tucked under the like little kidney beans.
so anybody that is in like a flexion position here, a couple things can be happening, but a lot of times if you go to talk to that person, hey, you do a lot of sit-ups? Oh yeah, all the time. So do you know what muscles activated when you do sit-ups? I mean, not typically your deeper core muscles. We call it the inner unit. It's really like your pelvic floor, transverse abdominis, multifidi muscles, and your diaphragm. So those we do goofy exercises to get those muscles to turn on. But if a lot of people said, okay, you guys have identified, yeah, they have a weak core because their hips are like going crazy. So what exercises would you typically give that person? Plank, leg lifts. Crunches, I know some people would give them crunches. I know you would. Side planks, that's probably the best answer I've heard so far. Those are anti-rotation exercises, which are great, okay? But a lot of people, well, and not just you guys, like anybody, well, I gotta do some crunches, right? So this is here, and you're kind of doing crunches and getting these muscles shorter, right? So what happens when we keep getting these muscles shorter? Then they end up like this.
Kidney bean.
Yeah. And then kidney bean. I'm gonna start using that.
Yeah, that's good.
Imagery.
I'm gonna have to keep you watching for those now.
Yeah,
We
exactly.
can go pinto. I'm a coordinator.
Yeah. So for the most part, you're going to see kind of two kinds of pelvic position. So it's Pink Panther, Donald Duck. You guys ever watch the Pink Panther? I'm old. You guys watch the Pink Panther? Okay, all right. So with Donald Duck, what's he do? He's got his butt out like this. So that's what Dakota was talking about. We get into a ton of extension, and they're running like this. Okay? And then it's Pink Panther. Well, Pink Panther is this, which I think is, I'm going to transition to kidney bean, is kind of that person that's like this. This is a little bit more rare. Most people, like Dakota said, will be in that extension because they can't stabilize their spine. They'll get into that closed pack position in the spine to try to stabilize it. But yeah, you'll have both of those problems. It's different fixes for both of those things. And it's typically for someone that's on the really far end of the spectrum on those, that's not like a SI joint mobilization, couple visit kind of thing. We've got to kind of reprogram how they're doing stuff, because if they're spending a lot of time like this or a lot of time like this, there's a lot of stuff that's going on that we need to fix. Any other questions?
I'm gonna ask it. You had talked about the thoracic spine.
Mm-hmm.
Some simple exercises to help get some more movement in that
Okay.
area.
Everybody lacks thoracic extension. Okay, so flexion is this, or flexion lumbar spine, entire spine is that, extension is going back, right? So again, what do most people spend a lot of their time doing? Sitting in a computer, and then what happens? Gravity comes down. What does gravity do? Like this. Okay, so you're spending a lot of time here. Guess where you're not spending a lot of time? In extension. So you don't have to spend an equal amount of time if you're in extension as flexion, right? You can, yeah. So there's
Talking about posture.
a good analogy. Do you guys ever hang out with fighter pilots? You ever see what a fighter pilot has to say?
Kind of. A little bit.
Okay. Right.
We weren't fighter pilots.
Okay.
We're fighters and
Cessnas.
Right. So, or that, like a small cockpit. So if you've ever seen some, like the cockpit of a fighter jet, it is tiny. Like it's hard for you to get into it, and you're tiny, right? So we put these, a lot of times, big dudes in there, and they're like, and they spend like a couple hours training like this. So they don't have to spend a couple hours in the reverse of that, they just have to spend a couple minutes there. So just getting into extension helps out. So foam rollers, I know you guys, there's a foam roller. All right, so just getting into extension is gonna help out. There's a lot of different ways that you can do that, but easiest way is just to find the thoracic spine. So what, lumbar spine here, right? Then we gotta go up a little bit higher. So lumbar spine, think of L5, S1 as being like at your belt level, a little bit above that. So thoracic spine starts up here, so you're just getting kind of back into here, and then you're getting into extension. Okay, now if you have someone that's like 65, osteoporotic, don't have them do this, because they're going to break their back and they're going to blame you, okay? So from here, you're getting into extension, and I'm just trying to spend a little bit of time here as compared to all day spending forward, right? Then I roll down, and I do some extension there, okay? So that is a really good exercise, but, you know, that's easy to mess up, like unless you're kind of keeping an eye on somebody. Like we don't give that to them typically a lot to do at home because we want to see them do that a little bit. Other thoracic exercises you can do is thoracic rotation. So we call this thread the needle. So just get down in a quadruped position, hand flat on the ground, and just rotating over as far as you can go. So that's going to get some lumbar spine and thoracic spine. So I'm getting rotation there, and then of course I'm doing the same thing on the other side. Right? Going over.
Your hand should be up. And your foot should be down.
Just for the opening up your shoulder, but that won't affect your thoracic spine that much, but I'm more worried about your shoulder than doing that. Yeah. So just put your palm up and then go across there. Yeah.
So there is some rotation that needs to happen at the running level of the thoracic spine.
So you want that to move, right? You would
So
want
I've
that.
heard from someone that I run like the road runner, Sean, right?
What?
Road runner, yeah, like and I found I don't rotate much to my left, like it's like everything's still, and then below it's like like a duck, you know. Road runner. So, you know, and can you speak to like there needing to be some rotational mobility in the upper spine? Or,
Yeah,
and
I wouldn't think about actively like that as. I think of these as like swing thoughts. Anybody golf?
Brian,
Yeah. Okay.
Lori.
So like when you step up the ball, there's like 17 swing thoughts you have, right? So you're like, oh, I gotta keep my weight back when I rotate through. I gotta keep my hands down when I get to the top. Like so many things. So I don't want you to like have to think about running a ton.
Yeah.
So my issue with that would be like, oh yeah, I've got to kind of start moving my spine side to side. For the most part, if your thoracic spine doesn't move really well and you try to think about going side to side, you're gonna chew up your low back. So it's more kind of doing just thoracic mobility stuff, and then naturally that will move. The thoracic spine doesn't move a lot. Okay, it's not like the lumbar spine or the neck. You guys ever move your neck? That moves a lot. Why doesn't the thoracic spine move very much? Anybody know?
Protecting your lungs.
Exactly. What's protecting your lungs?
Your ribs.
Your ribs, right? So there's ribs that attach into these facet joints, and there's not a lot of motion there. Okay, it's not like your neck or your back where you get a ton of motion. But whatever little motion you can get, you want to try to maximize that because it's going to take stress off of your lower cervical spine. So not a rocket science here. We talked about L5 and S1 being the 95% of issues to come there, so discs or stenosis. So 95% of injuries that come in the cervical spine, C5, C6, C6, C7. Okay, because that's the lower part of the spine. The thoracic spine doesn't move. So you've got this big block in the middle of the spine, and when the lower cervical spine has to move excessively because this isn't moving, and the lower cervical spine or lower lumbar spine has to move excessively, that's what causes the problem. Now, is having a really mobile thoracic spine going to solve all of your spine problems? Probably not, but man, it's a good start because nobody really works on that, and just the biomechanics of what's going on there, just understanding that is really important. So for you, if you say, I think I need my thoracic spine to move more, great. I don't even need to evaluate you. Do the exercises that we would give someone that move their thoracic spine, and it's universally going to help you out. Okay? I don't know if it would like fix all your problems. Like if you had low back pain and the only thing I gave you was thoracic spine mobility, there's a chance that might over time get rid of that. I would want to do some more specific stuff for the lower lumbar spine. But for someone that doesn't have any pain at all and doesn't want pain, man, it's hard to go wrong moving your thoracic spine more. That's a good point. Anything else? All right, so takeaways from this are what? What are we going to change in our practice as we start next week? The next time someone comes in and says, yeah, I got a little bit of low back pain, what's the first thing we're going to look at?
Tail wag.
Right. So if that's the only thing you look at, then you guys are going to be way ahead of anybody else that's fitting people for shoes. Okay? So you're just kind of looking at what's going on there. Again, we're not asking you to diagnose that. We're just kind of saying, yeah, that kind of moves a little bit much. Like how much, I even hesitate to say how much, it's core strengthening stuff to do because most of the core strengthening stuff that people do is not helping them out. It's actually making it worse. But you want to try to know a little bit about that. And they'll be like, yeah, not too much. Like, okay, do you have any tightness in the muscles of your hips? And again, there's certain length tests that we do. If someone comes in and then just puts their hands flat down on the ground, they probably don't have a ton of hip mobility issues, but they might have some thoracic spine mobility issues that we can help them out with some tools that we'll give you guys. All right, so we're gonna start looking at this stuff, right? So last time we looked at single limb squat and just kind of get in the feel for what that looks like. Now you're gonna start looking at people walk, and you don't have to watch them run. Typically, when you run, one of two things happens. A lot of times, actually, when people run, they'll activate better than when they walk because it's just a higher level activity. For the most part, they'll tend to fall apart when they run because and you guys, who has ever had pain when they ran, let's say, like a 5 to 10 mile distance? Has anybody ever had low back pain? Okay, okay, all right. Did you have it like right at the beginning or more towards the end of your run?
I've had it where it's like going into it, I've been like already sore, but then it gets a little better. Like it almost like feels looser by the end of
Yeah.
the run.
So as you kind
More
of
that,
increase
yeah.
blood flow,
Yeah.
that's more of like a mild inflammatory response, and it's like, yeah, you can kind of run yourself out of that. If it doesn't go away, that needs to be addressed. But typically, in our injured runners, what happens is they'll have problems towards the end of their run. Does anybody know why that is? Why does your form fall apart?
Fatigue.
Yes, that's why. Okay? So your muscles are already doing a crap job at stabilizing stuff. Well, if you get to the 5th, 6th, 7th mile, whatever that, with the end of someone's mile, some people, it's not till they get to their 20th mile, whatever. As you get to the end, the muscles that are already doing a poor job just get weaker and weaker, and then that's when you start to have some of the mechanical issues. For the most part, people that get injured on a run, like someone comes in, we said most people, I don't know when this started. The people that do come in and says, yeah, I got injured on a run, 9 times out of 10, they got injured on a run where they were just kind of pushing it a little bit further than they're used to doing, and their muscles couldn't stabilize what's going on, and then there's some kind of breakdown in the tissue.